The cuff tightens, the monitor flashes a number you did not expect, and within seconds your body starts making it worse. That is the trap with blood pressure. For adults over 60, high blood pressure affects about 73.2%, and most of the time it causes no symptoms at all. You can feel completely normal, see one high reading, get scared, and that surge of fear pushes you further into fight or flight. Heart rate rises, blood vessels tighten, and the number can climb even more. In that moment, most people feel helpless. But if stress is part of what is driving the spike, there is a simple breathing pattern that may help bring the number down within minutes, not by magic, but by changing the signals between your lungs, your nervous system, and the pressure sensors in your arteries. The reason this matters so much after 55 is not just the number on the screen, it is what that number can slowly take from you. High blood pressure is linked to stroke, heart attack, heart failure, kidney disease, and damage to the brain and eyes. For a lot of people, the real fear is not the diagnosis. It is losing independence. It is needing help with things you used to do alone. It is getting winded more easily, feeling less steady, thinking less clearly, or living with the worry that one bad event could change everything for you and your spouse. And the hardest part is that high blood pressure usually does not announce itself. It is often silent. Some people get headaches, shortness of breath, lightheadedness, anxiety, or even a nosebleed during a spike. But those are not reliable warning signs. Other clues get brushed off as just aging, like lower stamina, poor sleep, snoring, waking up unrefreshed, or morning headaches. Sometimes ankle swelling shows up if heart or kidney issues are also part of the picture. But many people feel fine until the damage has already been building for years. That is why a home blood pressure cuff can feel like both a blessing and a curse. It gives you information, but it can also trigger panic. So let me be very clear about one thing. If a reading is 180 over 120 or higher and there is chest pain, shortness of breath, stroke symptoms, confusion, a severe headache, vision changes, seizure or unresponsiveness, that is an emergency. Call 911. A breathing exercise is not the answer to a hypertensive emergency. But if you are sitting there with an unexpectedly high reading, you have no emergency symptoms, and you can feel stress feeding the number, you are not powerless. Slow-paced breathing can help some people get a modest drop within minutes, and it may help more over time when practiced regularly. The American Heart Association includes breathing control as a lifestyle strategy and estimates about a 5 mm mercury systolic reduction, with a general recommendation to slow breathing to fewer than 10 breaths a minute for 15 minutes a day. Here is why it can work. Inside your arteries are pressure sensors called baroreceptors. Their job is to help stabilize blood pressure from moment to moment. Breathing around 5 to 6 times per minute appears to improve how well that reflex works. At the same time, it shifts your nervous system away from the stressed, adrenaline-driven side and toward the calmer parasympathetic side, often called vagal activity. In plain English, it tells the body it is safe enough to stop pressing the gas pedal so hard. Heart rate can settle, blood vessels can relax, the whole cardiovascular system gets a chance to downshift. Here is the simplest way to do it. Sit down with your feet flat on the floor. Let your shoulders drop. Unclench your jaw. Put one hand on your belly if that helps you keep the breath easy. Now inhale gently through your nose for 5 seconds. Then exhale slowly for 5 seconds. That is one full 10-second cycle, or 6 breaths per minute. Keep going for 5 minutes. That gives you 30 slow, even breaths. Do not force the inhale. Do not try to fill your lungs to the top. And do not strain the exhale. Smooth is better than deep. Calm is better than dramatic. If you feel dizzy, go back to normal breathing. After the 5 minutes, sit quietly for a moment and then check again. Some people will see a modest improvement right away, especially if anxiety was part of the spike. Some will not. That does not mean you failed. It just means breathing is a tool, not a cure. Think of it as a fast reset button that works best when stress is pushing the number up. Now, for the part that gives you longer-lasting control, the best blood pressure foods are not rare, expensive, or trendy. They are the foods that give your arteries more potassium and less sodium. That is the foundation of the DASH-style eating pattern. Think spinach, yams, sweet potatoes, bananas, beans, plain yogurt, oatmeal, unsalted nuts, salmon, tomatoes, leafy greens, whole grains, and olive oil. This way of eating works because it is rich in potassium, magnesium, calcium, and fiber, while being lower in sodium and saturated fat. That combination helps blood vessels relax and helps the body let go of extra fluid. Potassium matters because it helps your body excrete sodium, and it helps relax blood vessel walls. The American Heart Association guide suggests aiming for 3,500 to 5,000 milligrams a day from food, unless kidney disease or certain medications make that unsafe. Easy food sources include yams, spinach, bananas, white beans, lentils, avocado, baked potato, tomato sauce, and plain yogurt. If you have chronic kidney disease, high potassium, or take medicines that raise potassium, check with your clinician before pushing high potassium foods or salt substitutes. Sodium is where many people get tripped up. The target is below 2,300 milligrams a day, and moving toward 1,500 can have a greater effect. The problem is not usually the salt shaker. It is the hidden sodium in canned soup, deli meats like turkey and ham, frozen dinners, fast food, restaurant sauces, pickles, salted snacks, processed cheese, instant noodles, bottled dressings, and seasoning packets. Even a few of those in one day can quietly drive fluid retention and push pressure higher. If you want one simple rule, eat more foods that look like they came from a garden, a tree, a field, or the sea, and fewer foods that come with a long ingredient list. Some salt substitutes can help because they replace part of the sodium with potassium chloride. The American Heart Association notes that these products often contain about 25 to 30% potassium chloride and 65 to 75% sodium chloride. For the right person, that can be a useful swap. But again, not if you have kidney disease, a history of high potassium, or take potassium-raising medications, unless your clinician says it is okay. There are also a few specific foods with promising evidence. Beetroot juice is one. A 2024 review found that beetroot juice lowered clinic systolic blood pressure in adults with hypertension, with benefits seen up to 90 days, although it did not show a prolonged 24-hour blood pressure reduction. Beets are rich in dietary nitrate, which the body can turn into nitric oxide. Nitric oxide helps blood vessels widen and relax. Most studies use concentrated or nitrate standardized beetroot juice, and the exact amount varies by study, so there is no one magic household dose. Just know it is a useful food, not a miracle. And yes, it can turn urine or stool red. Extra virgin olive oil is another smart staple. Reviews suggest it has modest blood pressure benefits, likely because it supports the lining of blood vessels and provides helpful polyphenols. A practical move is simple. Use extra virgin olive oil as your main added fat instead of butter or refined oils. Kiwi fruit is less established than DASH, or sodium reduction, but still interesting. In one trial, people ate 3 green kiwi fruits a day for 8 weeks. A later review linked about 360 grams a day with a 3.7 millimeter mercury systolic reduction. In one comparison, that is not huge, but small changes add up, especially when they come from real food. And do not ignore alcohol. The American Heart Association recommends no more than 2 drinks a day for men and 1 for women, and less is better for blood pressure. Regular alcohol intake raises blood pressure, and reducing it often helps. So here is your plan for this week. If a home reading jumps and you have no emergency symptoms, sit down and do 5 minutes of slow breathing with a 5-second inhale and a 5-second exhale. Then recheck. Write down what happened. And for longer-term control, pick one food change you can actually keep. Trade canned soup for beans and leafy greens. Switch from salty packaged snacks to a banana and unsalted nuts. Replace butter or refined oil with extra virgin olive oil. Add spinach, yams, tomato sauce, or plain yogurt more often. Small daily choices calm the system far better than panic ever will. You do have influence over this, not total control, not overnight perfection, but real influence. Your blood pressure responds to how you breathe, how you eat, how much sodium you carry, and how often you live in a stress state. That means your next reading is not just fate. It is feedback. And feedback is something you can use